Hi, this is Anil. If you recently moved to a new country and you or any of your family member gets sick, then it could be pretty challenging because you don't speak the language, you don't know how the healthcare system works in a foreign country. Today we'll discuss about the healthcare in Czechia. We'll discuss more about doctors, hospitals, pharmacies, what to do if there is any emergency, how to make a doctor appointment. So before we proceed further, if you like my videos, please subscribe to my channel. Okay, so to start with, first let's discuss where the healthcare of Czechia stands in Europe. So in Europe, it's ranked 14th, which is pretty good, I would say. If you compare it with US, then at least it's affordable in comparison to that. You will not go medical bankrupt in Czechia. So Czechia's healthcare is universal. What does it mean? It means it covers everyone in the Czech Republic, but insurance is mandatory part of it. So you need to have either public health insurance or private health insurance. So as a foreigner, if you have a job here, then you are already covered by mostly by a public health insurance. Or other cases, and maybe for your dependents, you might have to buy a private health insurance. So once you have the insurance, second step is you have to register with a GP. GP is general practitioner, which is basically a doctor, but you have to register with a doctor, GP. So in that case, what happens is whenever you have some problem, that GP is your first line of support. You will make an appointment with your GP. Your GP can do basic medical examination. If required, GP can write you a prescription for the medicine. And if situation is serious and you need to see a particular doctor like a specialist, then your GP can write you a recommendation as well. So that's your first support. There are two things here. One is it's tough to find an English speaking GP, but I think if you try in your social circle or try to check with or search Google, you can find one. Second thing is I have seen people are living here for more than a year, but they still haven't registered to GP. I would advise, as soon as you get your insurance, register with the GP, because sometimes there might not be any appointments available. You'll have to ask the GP whether they are accepting new patients. That's one thing. Another is, if you have kids, then you'll have to register your kids with a pediatrician, which is equivalent to GP for adults. Okay, so after that, let's discuss about hospitals. So there are many good hospitals in the Czech Republic, especially if I talk about Prague. The biggest one is Motol, and they also have foreigners department. But for every time you don't have to run in Motol. Wherever you live, every district has a big government hospital. And if I would say, every hospital has one specialization as well. So like they all have common facilities, but besides that, one hospital could be good for say neurology, another could be good for say orthopedics. But yes, some hospitals might have old infrastructure like old buildings, and in some of the hospital there's some old staff like nurses and all which doesn't speak much English, so that could be a little challenge, but yes, you can still do it. And another option is there are also a lot of private clinics. You can go there as well, but first check whether they accept your insurance and there are no extra charges. So once that is done, another thing is about the pharmacies. So for some basic medications, if you have some headache or something, you can just walk into pharmacies and you can explain them your symptoms, and they can give you some medicines like paracetamol or ibuprofen, those kind of things. Now one thing is most of the pharmacies are open during the weekdays, but very less pharmacies are open 24/7. So if you see, there are in every district in Prague, there is at least one pharmacy which is open 24/7. But if you go there, I think after 9 p.m. they will, and you want a medicine which is not in prescription, then they probably will charge you 40 Czech crown extra. But I think that's okay. And another thing is, I'm talking about cities, but if you go to any remote village or if you are on a vacation, then in remote areas you might not have a pharmacy available for 24/7. So please check on that. Okay. Now if we talk about emergency, so there are two situations. One is if you get sick over the weekend and you cannot wait till Monday to connect with your GP. So in that case, you can every hospital has a emergency department. You can just walk in there and they have all the facilities, so they can do X-ray, MRI, even they can do the surgery. They have surgery department as well. But what could happen is, sometimes there might be a little waiting time. Initially a nurse will check you, and they might have some SLA, so you might have to wait somewhere from 30 minutes to maybe 3 hours. It depends. And there is also a small fee. They charge 90 Czech kron, which is basically less than $5. Did I say $5 for emergency? Yes. So that's the current price. It's just $5. It might increase next year, but currently it's pretty cheap. So, and another situation, if I see in emergency, is the ambulance, right? If you have to call an ambulance, then the number for medical emergency is 155. And if you have to connect through European agency like emergency services, then you can try another number, which is 112. And I hope they speak English in this number, 112. And about your insurance, so once you call the ambulance, if you have public health insurance, then it's okay. If you have private health insurance, and sometimes you can, if you are in a good position, they might ask for your insurance. If not, then they might charge you 5,000 Czech kron for the ambulance as well, just to let you know. Okay, so once we are done with that emergency situation, then next is what are the challenges with the healthcare. So there are, if I would say, there are three challenges. One is how to make an appointment with the doctor. Probably I will take it at the end, if you have to speak in Czech, how can you do that? Another problem is, if you are hospitalized, then it's better if you learn the language, because if you have to stay for a few days in a hospital, all the staff doesn't speak English, so it would be beneficial for you. And the second is the food in the hospital. So the food is not that great, and especially if you are a vegetarian, that's a challenge. And one last challenge I would say is about the waiting time. Sometimes if you have to go for a specialist doctor, or you have to do some scan, there might be a waiting for a few months. So what's going to happen, your doctor will say, okay, you can do this scan in this clinic, and if you call that clinic, they will say, we do not have any slot for 3 months. So, and if you want an earlier appointment, what you can do is, you can ask for your doctor's other clinics, list of clinics. You can try calling them one by one, that is one option, or you can even search in Google and try calling them. So that way you can, if you try other clinics, maybe you will get an earlier appointment. If not, and if you are in pain, last option is you can also walk into emergency. Like I said, if you cannot wait for say 3 months, you directly go to emergency, and if they find it, then they will do all your scans if required, or you have to take off help of any NGO. So that's a thing. Now, after covering all these things, how to make an, yes, one more thing I would add here is about the sick leave. So once, if your doctor thinks you are not fit, you are sick, then doctor can write you just a small sick leave note, and you can give it to your employer, and then you can be on sick leave. It depends, you can stay on sick leave for probably up to 1 year. Okay, and last thing I would like to add here is, okay, how to talk in Czech, how to make a doctor appointment in Czech, or when you go to pharmacy, how to explain your situation. So just keep it simple. So for example, we call the pain as bolest in Czech. So if you have something, some pain, you can say my head is hurting, you can say bole minia halava. Or if you say anything like my knee is hurting, bole minia koleno. So that's how you can keep it simple. So if you are even calling to the doctor and you have to explain the situation, or you can write an email, you can say mam horichku, I have fever. Okay, and to get the appointment here, they used something word like control or termin. So you can ask something like that, or sometimes even they say order, like you have to order a visit, right? So you can say Khetal Vikse Obednath na Proholitku, something like that. So I think that's all. If you have any questions, please put it in the comment, and have a nice day. Bye.